Welcome everyone to our webinar on how to see health plus space, urban design for non-designers. This webinar is part of a 3-webinar series on the role of the physical environment on health equity. I want to first acknowledge the generous support provided by the Robert Wood Johnson Foundation for this webinar series, as well as the partnership with the Gehl Institute. We are honored today to have two wonderful speakers, Julia Dide from Gehl and Helen Eng from Lamas. And I also want to thank our board of directors and our freelance senior project manager, Radhika Ramesh, for working on this webinar. I'm Renata Schiavo. I will be your moderator today. I serve on the board of directors of Health Equity Initiative as its founding president. My own professional background is at the intersection of global health equity, communication, and international development, and I divide my time among different professional endeavors, including my consulting practice and academic appointments at Columbia University, Millman School of Public Health, and Long Island University, as well as I edit the Journal of Communication in Healthcare. My passion for health equity is rooted in my own childhood experience, growing up in a family with very modest means, as well as the many opportunities I had to observe both through professional and personal experience, the many systemic, structural, and access-related barriers people face to stay healthy throughout their lives. So what is Health Equity Initiative? Please allow me to say a few words about our organization. There are 66 of you registered for this webinar, and some of you are not familiar with Health Equity Initiative. We are a member-driven nonprofit membership organization dedicated to build and sustain a global community that engage across sectors and disciplines to advance health equity. We are unique in our dedication of bridging silos and building one community for health equity across different professions, geographical communities, disciplines, and so on. And we invite you to explore our website. So I was discussing our membership benefit, which include, discounted subscriptions to 6 different publications from Taylor and Francis, member-only social and networking events, discounted rates to, a variety of resources and workshops, as well as the opportunity to really being part of a community that is committed to health equity, that works together to actually advance health equity, and the opportunity to serve on many of our member committees and hone new skills to advance health equity. We also have basically a biannual summit for which members have discounted registration fees. So this is our own definition of health equity for the ones of you who approach us for the first time. Basically, we define health equity as providing every person with the same opportunity to stay healthy and effectively cope with disease and crisis, regardless of various determinant and influential factors like socioeconomic condition, race, gender, age, social status, and so on. Opportunity is a very American concept, but more specifically, opportunity is measurable because it's related to whether in our neighborhoods, in our society, we create a condition for people to stay healthy. So, for example, can we ask anyone to eat healthy if they live in a food desert where there is not access to nutritious and healthy food? So that opportunity for access to healthy food is one of the examples of the many opportunities people need in order to stay healthy and effectively cope with disease and crisis. This series, I want to introduce a bit this series because this is the first of the webinar in the series. The overall series is called Health Equity and the Built Environment, Engaging New Allies in Planning a Healthy City. Again, I want to thank the generous support provided by Robert Wood Johnson Foundation and the partnership with the Gehl Institute, which is also located in New York City. So the first one is a wide webinar series on the role of urban design in health equity. There is a growing body of evidence that links urban planning and the physical environment to health equity progress or the lack of health equity process. Not only, in fact, does adequate urban planning which includes, for example, the existence of a neighborhood play space and park, a safe street for pedestrians and bikes, adequate transportation system, and more, contribute to a healthy lifestyle, but also helps prevent and address different health conditions and contributes to socioeconomic development. The other reasons that by the year 2050, 70,000% of us will be living in urban areas worldwide. We also have collected a number of evaluation data, including from our 2016 summit, that supported exploring in greater depth this topic as the link between urban design, the physical environment, and health equity. It doesn't seem to be something that people are mastering yet, or they are really familiar with. So there was a lot of requests for exploring this theme in much more comprehensive detail. And this is, as a result, is an important area for engaging new allies who can fix conditions in the urban environment for helping advance health equity. However, the effective engagement of a number of non-designers is linked to empowerment and training, and this is part of the purpose of this webinar series. I want to close this slide with a curious fact which comes from a publication from Roger and Freeman, which speaks about the history of the field of urban planning, which in the 19th century was linked to public health in its origin, in the efforts of reformer to tame the disruption of early industrial revolution. With that said, this webinar series, like I mentioned, is 6 sections. Also the aims of all of this is to create a group of professionals and leaders in relevant sectors who have insights into how the built environment intersects with issues of safety, access to a healthy lifestyle, and a community's overall physical, mental, and emotional health. Our second aim is we want to leave participants with sample resources and some steps to become engaged or engage others in the urban design process. Other upcoming webinars in this series are listed here, one on July 19 and the other one on September 13. So we invite you to save the date and to participate also in this upcoming webinar. Now, a few items about this specific webinar. First, the aims. You will be learning from our 2 outstanding speaking some basic information on the process of urban design, as well as methods to observe the existing physical environment and evaluate in terms of potential needs and barriers to health equity. You also will be provided with some resources and opportunities for better understanding and engagement in the urban design process. The Q&A session is going to be at the end of all of the presentation, at the end of the webinar. Each of our presenters will go for 10-15 minutes each. And then there will be a moderated Q&A. I will start with 1 or 2 questions, and an audience Q&A that will be using only the chat function. And we ask you if you could please include your name, title, and organization as part of your question, and send the question to all, to the entire audiences. If there are similar questions, I will either group them or I will make sure to actually basically, select questions that are different so we have an opportunity to learn from our speakers on different topics. At the end of the webinar, we'll be circulating a evaluation survey that we encourage you to complete, as your feedback is very important to us in improving our programs. So without further ado, I want to introduce our 2 speakers today. The first speaker, Julia D. Day. She's an associate with Gehl Architects. Julia develops projects across design, policy, and strategy, and focuses on creating public spaces where people can engage with and shape their cities. She has worked with city governments and community leaders across North America and the UK to turn underused roadbed into play space, to make walking and biking convenient, attractive, and safe travel options, and to collect quantitative and qualitative data on things we value, such as sense of belonging, but that often are considered difficult to measure. With Gehl, she supports city leaders in creating initiatives where people are front and center in the design and city-making process. She has a master in city design and social science from the London School of Economics and a BA in history from Washington University in St. Louis. Our second equally impressive speaker is Helen Lang. She's co-executive director of La Mash, an urban design nonprofit that helps lower income and underserved communities shape their growth through policy and architecture. Helen provides leadership in creating projects at La Mash that are grounded in community needs and policy potential. Raised by working class, first-generation Chinese parents, Helen has seen how a lack of infrastructure and investment can impact a community. With a passion toward redefining the intersection of community development and social equity, Helen is interested in minimizing the impact of gentrification with opportunity for inclusive development. Currently, Helen is shaping La Mash strategy in exploring how backyard home can promote greater affordability, supporting small business holistically to compete and thrive in changing neighborhoods and creating low-cost, high-impact strategies to support pedestrian and public transit users.
And good afternoon, everybody. It's a pleasure to be on this webinar with you. When I first spoke to Renata about the theme of this webinar, Design for Non-Designers, I was really excited about it because I, for a very long time, did not see myself as a designer and still sometimes question the title. I thought design was something you did when you had to have really good drawing skills, you had to love using Photoshop, you had to be great at actually making and building models, and those are things that aren't my strong suit necessarily. But I've learned that design is a lot more than just how things look and the making of them. It's also about experience and based on experience and really understanding how to look for the connections between behavior and place. So I want to take you a little bit through how Gehl practice works and our approach to public space, urban design, and what we call public life. So Gehl is an urban design consultancy. We're interdisciplinary in that we employ architects, planners, landscape architects, as well as social scientists. And the practice grows out of 40 years of research conducted by Gehl on how people were using public space and the behavior in public and how that was affected by design in cities throughout Europe. We work around the world and have headquarters in Copenhagen and in the past 3 years opened offices in New York and San Francisco, and I'm based in New York. We approach our work as both social scientists and designers, and so what that means is that we're constantly looking at the connections between life, what people actually do in public space and their behaviors, and form and the built environment and how those two interact. Our mission overall is to create cities for people, and so to do this we always start with people. With any project, before we get into design and thinking about space, we want to understand what is the life of a place in a city. Why do we do this work? Well, primarily we really think design matters for a number of reasons. One, design affects our behavior, and by affecting our behavior it can lead us to do idiosyncratic things like sit on something very uncomfortable, like the man on the right, or engage in risky behavior like jaywalk if there's no crosswalk in sight or it seems too far away. But it also leads us to do really joyful things, like participate in a spontaneous snowball fight, which really did happen the first year that Times Square was closed to traffic and open to people. We also do this work because there's a wealth of untapped assets in our cities. In most American cities, 80% of our public space is street space. Yet, as we know, typically that space is devoted primarily to the movement and storage of vehicles. So this is an asset that is for the public and is just waiting to be repurposed. We also do this work because design, as Renata pointed out, can really exacerbate disparity and impact our health outcomes. I won't get too much into this because I think many of you on the call are familiar with this research, and Health Equity Initiative has much more of it probably than I do, but we know that studies from across the U.S. show that your access to park space and green space depends a lot of times on your race, and that white communities often have much greater access. But we also know that it's not just about space, it's also about the quality of space. And a lot of cities do have large open spaces like the City Hall in Boston, but if the quality isn't inviting and interesting to you, it might not end up being a great place to spend time. So sometimes small spaces are actually more valuable to a community than open ones. And the quality of our environment also impacts how we use public space and how we engage with our communities. It impacts whether we choose to walk, whether we can walk safely, whether we enjoy spending time outside, and whether if alternatives to walking or biking become available to us, we'll take them because they might appear more attractive. So, overall, we do this because we believe public life is essential to thriving, robust cities, but it's also essential to our health and well-being. Public life is what we do when we live our lives outside of the private realm, our homes, our workplaces, and our cars, and actually engage with the communities around us. Meet people, spend time alone, but just coexist with others. And increasingly, we're learning that the social time really has an impact on our health outcomes. How can we understand public space's impact on behavior? One of the core tools that Gehl uses is called the Public Space Public Life Survey. We use this because we believe data influences decisions, and to collect data on what we care about, which is people, we need to find and use new tools such as this to do that. This tool is part of our action-oriented people-first design approach, and by that I mean we really focus on, in all the work we do, on measuring what's happening in a space, what are people doing there, what are the activities taking place, using that data and understanding of existing conditions to develop tests, pilot projects that can further be used to engage people and also experiment with design solutions. And lastly, we refine, and that just means we learn from the tests, we continue to study and collect data on use, and then with those learnings, adapt as needed. And this is really a cyclical process that continues over time. The survey is a tool that allows us to go to where people are rather than to ask them to always come to us and tell us what they think. These two people on the left are actually counting people walking by, the volume and the age and gender. It lets us observe behavior, to measure existing conditions, and then to be a baseline that we can use to track change over time. And as you might have seen in that photo, the surveyors are using a paper and pen. So yes, it's analog. And increasingly, there are sensors that are being developed that can help collect data. But we still really believe in the value of having real people observing real life in real time, because this helps us understand experience and perception and your gut feeling in a place, and also capture things that sensors cannot necessarily, such as age, gender, children skipping, how happy people look, things like that. So what do? We measure people moving. We look at the number of people walking, cycling, and the age and gender of those people. We measure people staying, and this is a whole range of activities that we look at, from standing to waiting for transit to playing to lying down, to get a sense of where people actually feel they can spend time in a space. We also measure qualitative factors of a place, focused on three core areas of protection, comfort, and enjoyment. And this is a way for us to get a sense of the quality of the built environment and how that might be affecting the activities and uses that are happening there. And increasingly, we're also using tools in close partnership with Gehl Institute to understand not just the volume and age and gender, but also perception, sentiment, and socio-demographics of people in a space. We've created a series of Intercept surveys that help to get a sense of what people feel about a place and what they would like to see happen there. All of this data together informs our understanding of public life in a place and the patterns, how they change over time during different times of day, times of week, season, how those variations may change based on your gender or age. And they can also help us understand more qualitative factors like what type of sense of belonging do people feel in a place, or do they feel ownership of a space? And we mash all this data together to really understand what's going on and inform any design that might be needed. And to give one example, so we used a survey in New York City, and one of the core data points that we found was that 90% of the traffic along Broadway and Times Square was people walking, yet only 10% of the space was for people. 90% of the space in turn was for cars. And it was this data that the city, the mayor, and the transportation commissioner were able to use to say, okay, there's an urgency to act, we need to try something. And it allowed them to change paradigms and close Broadway to cars and open it to people using a pilot project. So we believe that you measure what you care about, and if you care about people, you have to find ways to collect qualitative and quantitative data on what's going on with them in a city. So overall, why do we study public life? We really believe that you can only build cities that support healthy, equitable outcomes when you pay attention to people. And that despite the fact that cultures are different and climates are different, we share many, many aspects of our behavior. When it's sunny and hot, we enjoy water. If it's cold, we also look for the sun. And at the end of the day, we are a walking animal. Our anatomy is the same. We have senses that need to be engaged. And the built environment can provide that stimuli that activates our senses and leads us to feel happier and more interested and feel more of a desire to get out and walk, for example. But so often our urban environments, especially in cities across the U.S., don't reflect our sensory needs or respond to them. We may have bus stops in a city, but they don't have places to sit or shade. Sidewalks, if they're there, may be uneven or disconnected. There aren't a lot of signals to pedestrians to say you are welcome here, let alone things to stimulate your brain and actually make the experience of walking interesting. Yet we know that people change their behavior when the context compels them to, not when policymakers and designers tell them what to do. This is a picture from Copenhagen where there's a really wonderful network of protected cycle lanes that's been built over the past 40 years. And people often think the Danes are a unique breed of people, but in fact studies show that they don't bike because they feel like Vikings or that they care for the environment any more than we do here in the U.S. They do it because it's the most convenient, accessible way to get around. And the reason it's that way is because the city has made a choice to change the built environment and prioritize getting around by foot and by bike. So where to start? I think just coming back to my own experience, trust that you do have a designer's instinct. Trust your senses. Trust how you feel in space. Do you want to be there? Do you want to spend time there? Why? Why is that? And use your gut feelings to inform what type of design change might be needed. You can identify what people care about, but that maybe hasn't been counted. What do people say they want in your community? and then work with them to find ways to measure it and get that data that can compel policymakers to act. And then get outside and start observing, talking to people, and collecting data. And that's it for me. Thank you.
Hi, everyone. This is Helen Learn with Ellie Mash, and good morning here from Los Angeles, where it's 10 a.m. As was mentioned, our organization is an urban design nonprofit working in Los Angeles, and our mission is to help communities shape their own growth. For those of you who are not familiar with LA, you're probably familiar with kind of our sprawling city limits where there are lots of people and a lot of cars and even more concrete and pavement. As an organization that is working in this space to really shape the future of lower income and underserved communities through policy and architecture, one of our values is that we really want to promote and support city growth that's equitable and self-directed. And that means we work in communities throughout Los Angeles, piloting ideas and programs and projects and hoping to change that on a citywide scale through policy, funding, or programming. So in a way, our work is really thinking about how do we kind of bring our different disciplines of policy and design and create impact to communities that often do not have kind of policy conversations or design support in their communities. My background, similar to Julia, is in policy and planning, and I co-run Ellie Mash with an architect, Elizabeth, and together our team is cross-disciplinary with folks from background in planning and policy, architecture, design, fabrication, community engagement, and most importantly, thinking about how can our projects really move the needle and make a difference in communities. So as you guys all know, LA has lots of streets and people think that no one walks on them. We have 7,500 miles of sidewalk, which means that they're often adjacent to streets. And this is kind of a funny overview of all the different bureaucracies and agencies that you have to work with on different levels, which really means that to get things done, you really have to be able to navigate through bureaucracy. And as an organization, we often are this intermediary between local government and communities, and doing our best to figure out how do we navigate between that climate. In Los Angeles, we have 15 city council districts. It's a strong council, weak mayor system, and with the 4 million residents in the area, that means each council district is kind of like its own city. We have a diverse set of council members that meet three times a week. They run committees, and we also have an amazing mayor, Mayor Eric Garcetti, that is able to shape the agenda of the city through various efforts. And what's exciting about the climate of Los Angeles is that there is a lot of interest in investment and innovation, exploring how do we make our streets a place where there is economic activity, where there's pedestrian activity, where we celebrate community culture and the people who live, work, and play in those communities. The mayor's first executive directive when he became mayor was to create the Great Streets Initiative, which is really a focus on how do we make our streets great again. And our organization has been privileged to be able to work with our amazing general manager, Salita Reynolds. We managed to take her from San Francisco, where she's really driving a vision of thinking about how can an agency that is traditionally thinking about transportation and cars and really thinking about how does that interact with people walking and biking, and how does that support the local economy. We also have a lot of council members that are interested in investing in ideas that are community-based, neighborhood-centric. This is a website for an initiative to focus on the revitalization and investment in the commercial core of a neighborhood down in Wilmington. So today, this morning, I'm going to kind of quickly go over, from our perspective, what does meaningful community engagement look like? And I think this is something that's at the core of the work we do, which is how do we learn from the people who are experts, the people who live, work, and play in the communities that we work in. And for us, that means that community engagement has to be more than a check off a box, a meeting in a dark room where participants are being spoken at rather than being listened to. We also believe that we really should build off the existing social fabric that exists. As a nonprofit that has the privilege and the honor of working across communities. We're invited to work there, and we realize that we're not the experts, and the experts are the people who are on the ground. So oftentimes when we work on projects, we often partner with existing organizations and businesses and leaders. There is a commitment of a Vision Zero commitment in Los Angeles to reduce pedestrian fatalities by 20% by the end of the year. And there's been a series of community installations and efforts to kind of raise awareness to this. And you'll see here that our organization kind of led this event, that we did so in partnership with a handful of organizations across all sectors, from government to community organizations to private and public as well. We also acknowledge that in a city like LA, and probably many of the cities and communities that you guys work in, that there are so many diverse people, diverse cultures, something that makes your community very unique. And what we always do is think about, what does culturally appropriate engagement look like? In this instance, we trained community members on how to be better informed about their rental rights, their landlord responsibilities, and their financial plan. And what we always do, especially in LA, is do everything in English and Spanish. If we have events, sometimes it means that we have childcare. We do it at times where people can make it. I also think that meaningful community engagement is also making really complex policy make sense. So I know that there are probably lots of researchers and policy wonks on this webinar, and I think it's very important that these complex policy topics can be broken down in a very simple way. And what you see here is the opportunity to break down complex housing strategies and not only educate residents on the very basics of options, but also inform them so that they can make an educated decision of how they would like to see money spent. Oftentimes we do this with infographics, examples, narratives. What's also important in terms of meaningful community engagement is to do it where people already gather. This is a courtyard of a local community member whose place is often a gathering spot for people in the neighborhood. So rather than have a meeting in a dark auditorium where it's complicated to get onto a campus, oftentimes we have meetings in people's backyards, on the streets, on the sidewalk. So in order to really build on meaningful community engagement, often for us, we like to be able to kind of do the research in a way that helps us understand the physical environment, the built environment. And the way we do that, similar to what Gehl does, but it's really based on being able to interact with the people in the communities where they're at. So it means taking a walk. This is we're doing a pedestrian improvement project here, and to better understand what are the challenges and the values and the feelings that people have, we took a walk with people who take a walk on this commercial corridor every day, and we get their feedback. And it really, at the core of it, is talking to people while you're taking a walk or while you're having an open house, to talk to people and informally have conversations about what they're thinking, what their experience has been. And more often than not, you find that there's such a rich amount of information that is really hard to gather if you're just studying people or providing surveys. As it relates to kind of the public space and public life and how our built environment really shapes health equity, talking to people who walk, who take transit, who are seniors, those are just kind of moments of being able to be sure that you are taking into consideration the wide range of people and their modes of transportation, and if they happen to be parents versus seniors, if they're customers, or if they're a store owner. And I think having those various perspectives helps shape a holistic understanding of the community that you want to work in, and to better understand the problem that you want to solve. As we're also trying to understand what the physical environment is, whenever we start our project, we also like to do observational studies and note where there isn't any people, and understanding the conditions that exist that create that. A blank facade, limited trees is often something that we see in Los Angeles. And yet you also have a similar experience where there isn't much shade, but there's tons of people. This is Santee Alley in downtown Los Angeles. And to really understand why are there so many people here, and what are they doing here, is important to understand. as you're thinking about kind of small businesses and the vibrancy of your commercial corridor and how that determines the strength of your local economy, we look at the small businesses and their facades and the pedestrian experiences and asking, what are the businesses telling you when you're just looking at it? Are they saying kind of go away because it's not as welcoming, the doors are closed, there's no clear way to interact? Or is it saying kind of come in, you can see some color, some light, people inside? This is an example of a Mexican restaurant that's been around for decades where previously the facade made it seem as though it wasn't clear that it was a restaurant nor that it was open. So we worked with the business owner and the property owner to kind of transform the storefront to make it a place that locals will want to walk to and that people who are driving by will know that it's clearly a restaurant with services. When we think about, where can you shop, where can you eat, there's something about kind of the visual signage and the facade really does make a difference. This clearly looks like a fast food place, but what we were able to do with this business owner was to help transform their exterior so it's clear that they are a healthy restaurant and market providing vegetarian options. And I think those small changes make it clear that you're communicating the food options that's available and the difference between fast food versus healthier food. Sidewalks in Los Angeles are often kind of complex patches, and this is an area in Northridge, which is in the San Fernando Valley in Los Angeles, and often you'll see sidewalks like this where there's not much life on it, and if you look at, well, what is the sidewalk telling you? It's telling you, hey, walk really fast because there's no place for you to rest. There's no moments or reasons for you to interact. And this is the same photo of a private property in the heart of Hollywood where there's limited space, where we did a pilot project that's going to last for over a year to test pedestrian amenities and explore how can we enhance the pedestrian experience on private property. And what this tells you is, hey, come slow down, enjoy this location, and projects like this kind of provide an example of how can we transform the pedestrian environment that really remove those boundaries between public and private. Similarly, as you're walking, where can you rest? Oftentimes in Los Angeles, your sidewalks are filled with lots of barriers, from signage to driveways, and there's nowhere you can really rest. So this is actually the same view of the same tire shop where, in partnership with the Mayor's Great Street Initiative, we were helping small businesses that actually had a presence on the public right-of-way be able to blend advertising for their business. You see Llantera right there, which means tire shop, and that signage is actually coupled with seating. And so you can have creative solutions that are low cost and short term to be able to really promote a more vibrant sidewalk experience, as well as supporting small businesses in the local economy. And the projects I just showed you include a range of tactical urbanism strategies, which I think is a very popular approach that's been taken by urban designers. And for us, we really see it as a tool to be able to do more. And specifically, what we mean by that is a lot of tactical urbanism is for several hours for a day, and we believe that there's greater potential with more than a one-day installation. This is typical of Los Angeles, which is a freeway on and off ramp. For those who are familiar, this is the interchange between the 110 and the 5. And as a pedestrian, it's not very pleasurable to walk. The sidewalk is narrow. There are no lights. You have bicyclists and pedestrians competing on a very narrow sidewalk space because cars are passing by. So with support from the Transit Center, a national foundation focused on urban mobility, we're exploring how can we use short-term, low-cost strategies to really promote that sense of walking, encourage and support the people who are already walking and taking public transit, and seeing how that can be done in a way that informs future policy. So some of our interventions, which will actually be in place by late August, if anyone's planning to take a trip to Los Angeles, feel free to come by. We're taking existing infrastructure that you see throughout cities, chain link fence, concrete, pavement, and being able to add a bit of color and character and being able to, without heavy infrastructure investments, be able to promote greater walkability, a sense of safeness, and neighborhood character. Tactical urbanism for us is also a way to start a conversation. It's often hard to say, well, what do you want here when there's no example of what's possible? Here we worked with local youth to be able to lead a tour of the small businesses on a corridor. The blue pillars that you see are actually made out of sonotubes to kind of highlight that, hey, this is a business and we exist. And having a simple installation like that was a great way for community members who live a few blocks away from a commercial corridor to have a conversation about the future of their commercial core and what small businesses could do to really promote that interaction that we see in small town, main street communities throughout the country. Tactical urbanism is often seen as something that's guerrilla, and all the work that I've shown you today is actually in partnership with government agencies and elected officials. This is in Northridge, where I told you it's very car-centric, and no one really walks on the sidewalk. And through a community design process, we were able to understand the culture of that community, the mid-century modern inspiration, and really be able to do something that has never been done in LA, the first painted sidewalk, the first time that plywood furniture was allowed on the street. And what you see in the yellow furniture is these are just a couple of 60-plus custom-built mid-century modern furniture that are a way to test, does this work? And if so, perhaps we can replace them with metal furniture down the road. And you'll also see that a bike lane is now there. So if you compare it to the image I showed before, where there wasn't many people walking, there weren't any bicyclists, now you have, through partnership with government leaders and community organizations, a transformed streetscape, an experience that really supports your pedestrians and your bicyclists, and actually most importantly, the small businesses that are supporting the community. We also believe that tactical urbanism has a great opportunity to be an example, to be a prototype for what's possible. So this project is called Hollywood Pop, and this is adjacent to a parking lot at the heart of the Hollywood Farmers Market that's been around for 25 years. This corner you probably would have never noticed before, but today is an example of what are some possible pedestrian amenities that could exist on private property or on public property. Do we want shade? Do we want seating? Do we want tables? And do we want wayfinding signage? And throughout the year, you have residents and customers and visitors be able to provide constant feedback so that when this kind of ends up coming down or becoming permanent, it's a short-term way of demonstrating what's possible before you can refine it into higher cost investments. So for all of you who are on this webinar, some ideas for you to think about in terms of how can you provide opportunities to your community to engage in urban design. Like I mentioned in terms of community feedback, it's more than a check off a box. So when you're asking for feedback, make sure it connects to real outcomes. These are some options of designs for Northridge, and the community actually helped shape the core theme that it happened to be translated into their street. So make sure that the feedback is leading to something. Oftentimes we run into parents and children and organizations who really want the opportunity to get their hands dirty. Here, this is a mural that's designed along the LA River, and it was a paint by number approach where we end up having over 100 community members help paint parts of it. And that opportunity not only kind of builds ownership and excitement, but it ensures that the community is excited to see this project be successful, and it could be as simple as paint. Or it could be as simple as planting. We often work with local youth to be able to transform their communities. This is an example of barricades put in a community that used to have lots of drive-by shootings and drug activity. So this was placed here a couple of decades ago as a reminder to block cars from entering a residential community. And today this area is transformed into a gathering spot that the community helped to recreate, and the local youth who live and work and go to school nearby got to shape that. Opportunities for community engagement is also something that you can do by just opening up places to the community that may not normally be open. This is a coffee shop that closes at 3 p.m. And in this instance, we had an open house workshop where the coffee shop was open in the evening, and that was so inspiring for the business owner that they actually have evening hours for the first time. one way that we found to really engage with community members that we work with is to understand what are some questions and uncertainties that are asked over and over again, and to think about how can you create resources that last beyond the one-time workshop. This is a commercial lease basics brochure in Korean, Spanish, and English that breaks down for business owners who don't have leases what are some basics that they should negotiate with their landlords. And we found that was a great way to be able to provide real tangible resources and have those business owners be engaged in whatever effort that we're leading. And finally, installations can be thought-provoking. As I mentioned, LA is committed to joining the Vision Zero Coalition, and here we noted in the red on a light pole the number of collisions that have happened in the past year and information of how community members can get involved. Closing, some of the lessons learned for us is start with pilot projects. It's usually a great way to navigate through bureaucracy, to do something a lot quicker in a shorter timeline with less money, and to really push the rules of what's possible. And that in all your projects, as you're thinking about that intersection between health equity and the built environment, make sure to involve the community and do so in so many different ways because that really creates community ownership and buy-in. And as it relates to our approach of using tactical urbanism to test ideas, low cost doesn't have to be low quality. And people will be surprised, and I'm happy to share if anyone's interested in the actual price of the projects that we worked on. And I think overall, to end, like these low-cost, short-term strategies really result in high-impact change. All the ideas that we had shared actually has shaped long-term policy change, programming, and funding. So thank you all so much for your time, and I'm happy to take any questions, and feel free to email or give us a ring.
Thank you, Ellen. This was a very, very informative presentation. I really appreciate it. I'm going to start off the Q&A with one question actually for you, Helen. And so the question is related to basically you spoke about the different players that are involved in the design process, and so wanted to know if someone had to approach anyone to become engaged in urban design in LA or in any other cities you're familiar with, where they will start.
It's a great question, and there's so many ways to go about it. As Julia mentioned, you don't have to be a designer to engage in urban design. The first place to start is thinking about who are the community organizations that are already doing some work in health equity, and how can you translate that into a pilot project or a short-term experiment. That's where we always start. We think about who's already on the ground, who's doing somewhat similar work, and who cares about the issues that you're trying to address. Second, I would think about your elected officials and your government agencies. Find that champion within your local government, and find that elected official who's interested, invested, and potentially could sponsor something that's a bit different. We have found that the projects that are most successful are those that we've been able to find a champion within an agency or an elected official who's willing to take a risk. And third and finally, think about your small businesses and the small businesses as well as the organizations and the residents that are adjacent to the spaces that you want to transform. Oftentimes they're already doing it in potentially a guerrilla way, a small business with informal signage, putting tables and chairs out, an organization that saw a need in the neighborhood and has created an informal farmers market because they know it doesn't exist. And I think that if you start at least with those areas, I'm sure you'll be able to find many opportunities to be able to engage in the process of urban design.
One question from Mardell Sharpley, whether you have looked at the relationship between violence and crime and urban physical environment, and if you can share any thoughts on this.
So this is Julia. It's a great question, and it does come up quite a bit for us. And it's something that we do want to look more into, and I believe Gehl Institute is also looking into. The one thing that we do know is that the presence of people makes people feel safer, especially when you have a balance in gender and ages. So it's really important to think about not just how to get more volume of people in a space, but what are the things that make a space inviting for women and children as well. And I can't say we've done a study that shows a direct link to a reduction in crime, but we know that those things can really help with a sense of safety. And in a lot of places we work in the U.S., there is a perception of danger and crime, but that is not actually reflected in data. And we do think by enhancing the built environment and in making spaces more inviting for people and activating a space, you can improve that perception, but that is different than the hard numbers related to actual crime rates.
Thank you, Julia. That's very helpful. I have another question from Kukoi, I think. The question is, as a public health specialist, I'm interested in learning if you have measured the impact on better quality of life after these projects are conducted. Is there funding to do this work?
Oh, this is Julia. I can share just a couple examples from New York, where the city of New York has done follow-up studies to measure the impact of public space projects and has found great things, both in terms of how people feel. They feel safer. They feel like an area is getting nicer, and businesses. There's also been some studies done to show businesses report improved sales as well. We are increasingly trying to do more work to understand follow-up, to do follow-up studies and understand impact. And I do think there's funding out there, although it's not a core focus of our work at the immediate moment.
This is Helen. Just addition real quick is to think about reaching out to your local community foundation. The idea of actually measuring real outcomes and knowing if something works is something that I've seen a lot of foundations want to invest in. So just because it's not part of their request for proposals, I would encourage you to reach out to your local community foundation or even your local elected official, because they may actually have funds that they can reprogram from existing projects that may be relevant.
I have another question for Bob presenter. But Julia mentioned in her presentation that they try to assess and improve quality of space. Because of the intention of this webinar to provide particular directions on basically how to become involved, what are the top 5 criteria that you will use to define quality of space?
It's a hard question too, because I think that is context and community specific. There are some things we feel are universal qualities, like protection and safety, which goes to the earlier person's question. If people don't feel safe in a space, safe from traffic or safe from crime, doesn't matter how beautiful it is, they're not necessarily going to use it. So I think some things like that are universal. We also think how comfortable you feel is very important, and that's in terms of, are you protected from the sun or the wind? Can you talk? Can you see other people? Can you see what's going on around you? But I think to really to get, and we have a whole criteria of 12 categories that we look for in space, but what we also try to do is, wherever we're working with the local community on a project, is to, through engagement activities, identify what are the qualities that people care the most about there, and how can we use those as success criteria or metrics to look for in our analysis.
That sounds great. I don't see any other questions from our participants, and because we are just finishing up with our time, we invite all to actually complete our survey, and the link is going to appear very soon in this moment in the chat box. Our Radhika Ramesh from Health Equity Initiative is going to disseminate to all. Thank you very much for participating in today's webinar.